Have you been gaslit into believing your health status is not related to your antidepressants? We are your whistleblowing shrinks, Dr. Teralyn and Therapist Jenn, and this is the Gaslit Truth Podcast. We are heading into this strong and a little bit differently today because we have a phone recording, and you can also see the video on YouTube if you go there. You can't see the video of the people, but we have it kind of documented in video of an actual conversation with Jen's medical doctor's office. And this is how she was gaslit. Roll tape.
Could this be a product of me going through a medication taper?
Medication taper as far as like what medication?
I'm tapering off of Lexapro and have been for 17 months now, 16 months.
No, usually no. The Lexapro wouldn't like increase your sugar.
How come?
Usually you don't see that with medication. Usually, it's the way your pancreas is working.
Right, because I
But
also...
you're on a very low dose of the Lexapro, right?
I'm at 4.7 milligrams. I started at 20. However, the last handful of months of this taper, the most taxing on anxiety for me.
We lost
So
it.
at this point, I am diagnosed with hyperglycemia, and I am told by the nurse that I need to start looking at some pre-diabetes protocol. So there's a little audio at the end that I did not put in there, and that's what you guys, if you're watching on YouTube, you will see right at the very end is the statement made to me about pre-diabetes. Sharing this for those of you that are on YouTube and watching this, if you're there,
because hopefully it'll.
and if
our bandwidth is a little weird
to go on any of my... Yeah, it is our bandwidth is a little bit weird
whenever
here, but if
we
you want
try
to
to
see this
bring
whole
in
video again,
I know
it's stupid. It's weird, right?
Whenever
Like,
we try
we
to
both
bring
have
in
good
extra
legit
videos, it
to
all
it.
goes crazy.
It's fucked
It
up,
was a
but
good video.
I know it's a good video. So if you want to see the whole thing too and rehear it again, right, you can go on my socials, either on my TikTok or on my Instagram, which we've got those linked here in our show notes. And you can watch this again because this is a actual real call that happened between me and the doctor's office about a few weeks ago. So
I have to say, you're welcome for telling you to record it because who knew it was going to be content for later.
All right. So this, I do have to give the credit to Terri for this because she goes, you should just record this phone call. So the long story short of this is I was having some routine work that is going to be done at the doctor's office. And part of that routine work was I had my thyroid tested and they wanted to test my blood glucose levels and all that good jazz. And I said, well, yeah, it's been a little bit since I've done that. So I should, right? And the results of that came back with a very, very high blood glucose level. I did a fasting glucose, and I was at 147, which is extremely high. So that led to a phone call, me telling to go do more testing, starting pre-diabetes protocols, blah, 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 and multiple dismissals, which is what we're going to talk about today. That happened in this phone call. And in the eyes of Western medicine, I have diabetes.
It's your pancreas, though. It's suddenly your pancreas.
What Terri and I are going to talk about today is we're going to bring some research in about SSRIs. And we're going to talk a little bit about some stuff that's out there that actually does draw correlations between SSRI use and different types of metabolic syndromes, including diabetes. So
it's funny because, we'll get the people that come on and be like, correlation does not equal causation. And I'm like, and then I had somebody do this on my TikTok just the other day. Correlation doesn't equal causation, but we already know that depression causes people to have lower health statuses. And I said, did you just try to debunk my correlation research with more correlation research? Like you just
Here's
whatever. I'm
You know
sick of
what?
it. I'm
We get so far down that rabbit hole of research, right?
yes.
Which is why you and I like we and I don't know, I encourage like any of my therapy clients, any of my like deprescribing consultant like coaching clients, I tell them I'm like research is there and it's great. Kind of like when Raquel was on the show and she said the same thing. In some
Mhm.
ways research can lie because we're really focusing so much assuming that there are no confounding variables in any of this, right? But we
Right.
bring it in for awareness for people, but it doesn't mean you have to put all your eggs in the fucking research basket, right? Because if you put every
Yes.
single egg in there, you're going to be like, if we were in the Western medical research basket right now, Jen needs insulin. Let's rock.
Yes.
Here we go. Like
It's her
diagnosis,
pancreas.
you're
Mhm.
done, right?
Yep.
So what we want to talk about here is there are so many of us out there that have taken SSRIs, taken antidepressants, and have had medical issues that have come as a result, possibly, of taking those. Okay.
Mhm.
And when we go to the doctor's office, the idea that SSRIs could possibly be causing some of these medical issues, right, is dismissed, and it's dismissed so quickly. So as you guys heard in this phone call, first of all, now mind you, I've been titrating for like 17 months now. That
Forever.
provider's
Mhm.
office,
Didn't
they
realize it.
know me very well.
Do they
I
though? It sounded like
Oh,
they
well,
kinda didn't. They
this is the
should, but,
same nurse I had to lie to try to get a liquid,
oh,
everybody,
that's
because I
right.
had to lie to her multiple times and tell
I
her I couldn't swallow pills because they
yes.
didn't wanna give me a liquid. So I tried the whole lying route, and she called me on it because she put it in my chart that patient lie, right? So this woman knows me. I call every couple months. I am the most tenacious fucker when it comes to them knowing what's going on with my titration because they hold the golden ticket to my prescription, and that
They
is
do,
very
and I
important,
also feel like it's
you know?
part of you kind of educating them, like, watching you go
Every
through
time I'm
this,
in there.
right?
This is the same
Yeah.
doctor's office that I walked into with this book and
Oh, yeah.
repeatedly threw the deprescribing guidelines in front of them and said, "You guys need to look at this. You
Yes.
need to look at it." It was the day I felt like I was fighting for my life to get this liquid prescription. So they've been with me on this for a long time, a year and a half. And so the first huge dismissal is, well, what are you titrating off of?
Right?
Now, I had just been there like 3 days prior and met them and talked.
Well, I wrote down a couple of different things. The first one is, well, no, it can't be that, it's your pancreas.
Yeah, it
It's
can't
suddenly well,
be.
then I would say, why does suddenly your pancreas have problems? Like,
Right,
why did that happen?
right.
So the second thing is, and this, we hear this a lot, is,
Dose.
well, you're on such a low dose. Like dismissal of the
Yes,
dose
the
is
dose.
irrelevant, right? Like,
Yes, yes.
yes.
It's irrelevant. So not only do
Yeah.
they not know I'm not titrating, okay, which
Mhm.
is crazy to me, right? The second part of it is that there's no education that they have or awareness that they have on the fact that an SSRI long-term use, okay, 25 years almost, right, can actually
Right.
lead to these issues with metabolic functioning. And as you can hear in this call, the nurse is, no, no, that can't be.
No.
So then I say, well, how come? Tell me, like, give me something, and they can't, right? So, for all anybody listening that's a provider, for the fuck's sake, like, humble yourself a little bit. If you don't know an answer, say, I don't know. Maybe we got to look more at this. Maybe there is something to this correlation you speak of. Like, for the
And,
love of
I
God,
I
like,
do I do wanna bring that in a little bit too. Why is it that we have to provide an answer or think that we have to provide an answer? Could this possibly be she would have been better off saying, "I'm not sure, actually. Let me look into that. Let me
yes,
see," right?
yes,
Instead of just saying,
yep,
No, it's your pancreas." Like, "Oh, suddenly I have a diseased pancreas. That's interesting. Why?" I don't know.
Yeah.
It just happens sometimes,
Well,
whatever.
and the
No.
part of the call that you guys didn't get either, right at the end, was how she went on to tell me that there are no correlations between high anxiety and blood glucose levels.
Oh, well, that's
Um,
there too.
and
Mhm.
so that too is quite one very, very dismissive, because as we know, because I started to tell her at the very end about the heightened anxiety that I've had during this taper. The last 3 months has been really, really, probably I would say that the toughest for me in terms of symptoms I'm experiencing. And we know anxiety impacts blood glucose levels. It releases your hormones, it releases cortisol, it releases adrenaline, right? And those increase glucose production, and also can reduce how sensitive you are to insulin. Like, this is something that I just want to, I can't say it's common knowledge, but I'm not really quite sure what the words are, because to
I
tell me
think
that's
common
not,
knowledge is a good word.
to tell
I
me
think
that's not real is almost like malpractice. Like, that's,
well,
I
I
don't
wanna
even know
bring
how to
this
say
in.
it.
I do, because I wanna bring this in as part of, like, somebody's treatment plan if suddenly, because this would be like a type 2 diabetes situation.
Correct.
One of the things that they would recommend is nutrition and then stress reduction. So
Correct.
clearly they know. Why would you even say stress reduction if it didn't matter?
Yes.
If that stress and cortisol was irrelevant to the conversation, why would you even have it as part of a treatment plan? So
Yes.
it's part of everybody's treatment plan for like every disease state. Stress.
It really is. It
you know?
really is. So that
Yeah.
I think was the cherry on top of, like, all of the different dismissals that are
Mhm.
occurring, right? These, I call, in the, if you're not watching on YouTube and you're just listening to us, the deliverable I put out on this was naive dismissals, is what I called it. And I'm writing out all the naive dismissals that are occurring along the way, right? Like, what
Mhm.
medication are you even taking? No, that doesn't affect blood sugar. Oh, it's got to be a pancreas thing. The pancreas is, like, all of these, there's no
Mhm.
evidence to back the statement that she says, and so these are the things that happen to us as patients. Now, then of course I put this out um on my socials, and I'm so, like, I can feel myself getting extremely anxious talking about this, because it pisses me off so much, right? Like, I'm physiologically reacting right now. My heart is just racing talking about this. So, background information for everybody, just so that those of you who are, like, really stuck on the Western model can maybe get curious a little more. I have absolutely no family history of
Right.
diabetes for any first degree relatives.
Mhm.
I have one relative that does have it, and it is 100% lifestyle, and they are the epitome of the standard American diet, and it's pretty dangerous shit now. So
Mhm.
I have none of that. I also live the pretty much, epitome of what is a damn
Well,
healthy lifestyle.
I don't know what other nutritional changes you could
I
make,
mean, yes,
actually,
I mean,
you know?
and I've done that, right? This has been a 2-year process for me.
Right.
First, I started by getting my adrenals in check, because I was
Mhm.
in adrenal failure 2 years ago.
Mhm.
I started there and went all the way through everything from nutrition to meditation to sleep
Mhm.
and everything in between. So, I'm pretty sure I'm the poster child for dialing in a lifestyle.
Yeah. Well, I mean, so when she called me and we were talking about this early on, it got me thinking a little bit about me, because when I was taking the antidepressants, I remember being put on metformin at one point, and for pre-diabetic
Pre-diabetic.
stuff.
Yeah,
Yes, but I've always struggled with weight and all these things. So for me, I was like, well, I mean, maybe it makes sense, blah, blah, blah.
right.
All metformin did was make me shit my pants, which is what all these meds make me do. But anyway, didn't help anything else. But as she was talking, I was like, holy shit, that actually happened. And I haven't, since being off of that many years ago, I haven't had any blood sugar problems at all.
Yeah.
And I look like, between the two of us, like if you were to just like, look at, I would be the one with type 2 diabetes issues here,
The
not Jen.
diabetes. It's gotta be the diabetes,
Diabetes. I
Terry.
got the
Yep,
diabetes.
got the diabetes.
But I don't. I don't have blood sugar issues. I don't have, the only time I
Huh.
did was when I was on an SSRI and put on metformin. And I didn't even connect those dots at all until she
Yeah.
said that. And I was like, holy shit balls. Like,
Yep.
that actually happened. And I'm like, wow, because I know I also had metabolic problems when I was on it too,
Yep.
weight gain and things like that.
Yeah.
And, metabolically, this stuff can impact you. But it's so funny because when you really start talking to people and they tell you all their health conditions they have
I,
and all the psych meds they're on, and my question always is, did those things happen after you were put on
yep.
the psychiatric medication? And the majority of times it's yes.
Yes.
And especially when I see younger people now suddenly having high cholesterol
Right.
or a heart murmur
Right.
or
Right.
all these hypertension, like all this
Yeah.
high cholesterol, they're young, they're healthy, they're on antidepressants or psychiatric medication, and now
Yes.
their health status is bad. And so the argument is, well, health status can be bad if you have mental health issues, without medication. I'm like, I mean, true, because people aren't taking care of themselves. There's a lot of lifestyle factors involved and things like that.
Yeah.
But we cannot dismiss that they didn't have those before they were put on
Right.
the antidepressants. So,
Right.
yeah. And we're not talking about just tricyclic antidepressants here. We're talking about your standard fare SSRIs,
Yep.
SNRIs.
Yep.
So, we're
Yeah.
going to talk
And
a
that
little bit
we've
about
got.
this research, yeah,
Yep.
that Jen sent me. And this is interesting stuff too, because I think we should probably do a whole episode on the heart, because that scares the shit out of me with heart. But these are really conversations in the realm of you can't get something for nothing, right? Like
Yeah.
what you put in your body, there is an input and an output, and this is part of it right here. So, and this is just one piece of literature, right? So
Yep.
take this piece of literature and get curious about this. Go to the citations and look at how they who they use to cite in here, and that will lead you down a rabbit hole of darkness. So be careful.
Does. It does. And then you can't stop reading and
You cannot
researching. And
stop.
I tell you, if
No.
you were in the last month, if you're a client of mine, this is something that I'm constantly funneling research to my
Yes.
clients on, because what's very interesting is a good chunk of them have got some form of a metabolic syndrome that
Mhm.
they are going
After.
through and that they are
Mhm.
medicated for. And we've been talking about these correlations for a while,
Mhm.
but all of a sudden now I'm in it more. So I'm pouring my time and hours into research reading, and then I'm
Mhm.
funneling this out to everybody. Right. So
What I just wanna mention this, what I don't understand is the people, like, when I present a piece of literature, I'm not presenting it as the absolute truth. There's really nothing out there that is
yes,
the
you are.
absolute truth.
Yes, you are, Terry. You are.
Otherwise, we wouldn't
Stop.
have more research opportunities if
This
someone's like,
one
"Yep, this is."
study with
Yes.
99
Yes.
middle-aged women in that we're gonna
Right.
talk about, this is the be
Right.
all
This
end
is
all,
it.
people.
This is
This
the
is
end
it.
all
This
be
is
all.
this is it.
Yes. But if you're reading the research articles that we bring up, don't read them for don't try to poke holes in all of it because you don't want it to be true, right? Like,
Right.
I feel like that's where people come from. They're like, "Well, I'm gonna find all the bad parts about this research." You can do that for any research article. Like, there's plenty of
You can always find
not
what you're
good
looking for.
research. You can always find what you're
Always.
looking for. So when you
Yep.
do this, do it with an open mind of curiosity instead of, I don't want it to be true and, whatever, like, be curious about it. So that's all I'm going to say about research right now. So, because we know there's a lot of shit research out there, but there's a lot of not
There
shit
is.
research.
Yep.
And it's funny. One last thing. Somebody said, "Well, this research that I presented called for more research. That
It
means this
does.
research wasn't good." I'm like, every research article calls for different research on the topic.
As
That's
it
how we
as it
develop
should,
research.
because they're gonna
Yes,
find where the gaps are, and then
correct.
need to call
And
for
then
more
research
research on
that
those
gap.
gaps. That's
Yes.
exactly, yeah, so that's
Yes. Yes.
really good comment, whoever that was, thank
It
you.
was
You
so
really
smart.
made Terry
Yeah,
smarter.
it
You
was
really
so
helped me there.
smart.
Yep.
Yeah. So let's look at this article. It's called The Relationship Between SSRIs and Metabolic Syndrome Abnormalities in Patients with Generalized Anxiety Disorder, a prospective study. This is in the National Library of Medicine,
Yep.
published by PubMed Central. So,
Yep.
anyway, what's the date? Oh, the date is 2013. So this is freaking 12 years ago.
This is 12 years ago, but my nurse knows nothing.
She knows nothing.
This isn't a thing. My goodness. So this is kind of old. I found this though, and I thought that was very relevant. Even though it's not brand new, this is the start of them calling for more research, even in this article, which is pretty cool. Because it's of course, we have stuff that is newer, and you can find stuff that's newer. But what's interesting to me is this idea that this really, truly, specifically the relationship between SSRIs and metabolic syndrome, over 10 years ago,
it's there,
was already being studied, right? So,
right.
What do we got, Terry?
I would guess because the amount of people that have been prescribed this is going up and up and up, that you're going to see more diabetes, more all these things.
The first line of this article is SSRIs are some of the most widely prescribed medications in the world.
So
why they pick this makes sense, because they are.
It makes a lot of sense.
They still are. They still are.
Mm-hmm.
Yeah.
The next line, though, I take beef with in order. In addition to their effectiveness of what SSRIs were reported to be associated with the side effects of weight gain, sexual dysfunction, drug interactions. I can't even say this word. Extra pyramidal. You know what that is? I had to look that up.
Yeah.
I had to look that up. Do you know what that means? It's a group of movement disorders. It's like tardive dyskinesia.
I was imagining a pyramid of symptoms, like Maslow's hierarchy of needs. That's what this pretty girl thought it was.
It says right here, these symptoms can include akathisia, dystonia, Parkinson like tremors, involuntary movements. And I'm like,
I know. I looked it up too. I didn't know what it was.
Yeah, if we were to
So that's what we've been talking about. There's a word for it.
Yes. There is, but nobody knows it. And
it was labeled, guys.
But anyway.
Yeah, whatever.
And discontinuation symptoms, however, they don't know. The metabolic parameters are poorly understood. So these guys, I think, well, Jen, you looked in this a little bit more deeply than I did. But there was 97 women aged 20 to 41 without any metabolic or psychiatric comorbidity. So it was just anxiety were included in the study. So the meds that they looked at were oh gosh, I wrote all of them down.
Which is paroxetine, Zoloft, which is your sertraline, Celexa, citalopram, the Lexapro, which is what I'm on, which is escitalopram, and then they also had Prozac, which is your fluoxetine.
Well done. Done. Yes. Yeah. Anyway, so they looked at these women who were taking these medications, which are your pretty typical SSRI meds.
Yep.
And they found some very interesting things. And I think you should copy this off and take it right into your doctor's office.
So I did print it off.
Did already.
Now, to be fair, I fired them, but I do have to I do have to go back I got to have my PAP done, right? So I already found another doctor, right? Of course, I found someone who's just a little bit more holistic, probably not nearly as much as I am, but someone who at least is a little bit more open to things. So I did call back and tell them that I fired them, but I do have to go in there for my PAP. So when I do, I'm just going to slide a little more research to them so they can have a better understanding of the fact that this has been looked at for the last 15 years already. So, but what this study did, and we can read in general. So what they found is in the group that was taking Paxil, that paroxetine group, there was a pretty significant increase in their weight, their BMI, waist circumference, fasting glucose, total cholesterol, LDL, triglycerides after about 3 to 4 months of treatment. So they say 16 weeks. So they took these women who had no other comorbidities, and they were just bill of health, and you have anxiety disorder, and they put them on this SSRI for 16 weeks. And here's what happened. There were significant increases in triglycerides in the citalopram group, which is the Celexa group, guys, and the escitalopram group, which is the Lexapro. In the sertraline group, the total cholesterol level increased after treatment. So your cholesterol is going up for sertraline. And in fluoxetine, there was significant reductions in weight, cholesterol, and triglycerides. So in the fluoxetine group, there were actually some reductions that happened with weight, cholesterol, and triglycerides.
Correlation doesn't equal causation. I'm just kidding.
I know. Yeah, right. But what this study is concluding, and it's showing, is that they say they're one of the first studies that really prospectively described metabolic syndrome and looked at what that is and the abnormalities in patients that take SSRIs. But in general, all of those SSRIs, with the exception of one, were leading to problems with BMI, weight, blood
Mhm.
glucose, triglycerides. They actually break down some of the cholesterol things in here too, which very interesting. My LDL cholesterol is very high.
It's
So
usually the LDL, I believe, is what is
yep,
the
that's your bad.
marker.
That's your
Yeah.
bad cholesterol.
Mhm.
Mine was very high, guys. So just so you know, when I looked at this, one of the things that I panicked over a little bit, besides the fact that they're telling me, "Hey, my diabetes," I was like, "Nah, fuck you guys. You know what you're talking about." But I was worried about the cholesterol part because my LDL is quite high. I went back and I looked at my cholesterol for the last 6 years because I've got all of it, and it has been high, but not quite this high. So that's interesting to me just because I need to pay attention to that, even though like my HDL is in a good spot.
Mhm.
Overall, my cholesterol was high though. And that's with a lot of really good lifestyle shit going on.
Mhm.
And I've
It's
never
it's
had that,
interesting,
right?
and with the tapering down,
Correct. Tapering.
so
So
yeah.
that's the
Mhm.
part. So here's the change, guys, for me is lifestyle went into I kicked that into gear, like epitome of eat, sleep, move, meditate, got that dialed in. But a year and a half ago, what did change is I started to titrate off of this Lexapro. I have all of those levels from years prior. Okay. And they were pretty stable, which tells me that as I am removing this medication from my body and improving all of my lifestyle stuff, there's something that's going on within my body that is now kicking out fucked up blood glucose levels. Now, to be fair, that could have just been an error on a test.
It
Because, of
could've.
course, what did I do? I did what Terri told me to do because sometimes she's so smart. And I went and started taking my blood sugars every fucking day, multiple times a day. I'm a week into doing this.
She's fine.
I've never had a high blood sugar, guys. Never over 101. That was my highest. So I just have to tell everyone
It could be but you know what's weird?
could
It
be a
could have
fluke.
been a fluke, but it's listed diagnostically in your file now.
I now have a diagnosis of hyperglycemia. I
It
was
said
given
diagnosis,
I yep, I
hyperglycemia.
was diagnosed already, guys, off of
Mhm.
one fasting blood glucose test. So that's another thing that I think bothers me too in this process is those of us that are taking antidepressants, and I know a lot of people listening probably are going, oh my God, I've had high blood sugars. I've had issues with my
Mhm.
heart rate. Yeah, you probably have and didn't have any existing conditions, right? And
Mhm.
that's something that I think you got to be curious about because there are errors in testing that happens. Terri and
Mhm.
I went down the dark black hole of what happens with blood blood fasting glucoses if you fast for too long. And there's a
Yes.
bunch of research out there about like if you do a 10 or a 12-hour fast, which I
Yes.
did, right? I was like, well,
Yep.
stopped eating at 7:30 and drinking at night and went and had my blood sugar test at 6:30 in the morning.
That's
Which
funny. I gotta
was a
say
pretty
that's
long.
interesting. That's interesting because I did have one blood sugar elevation, and I didn't eat. I had to go in at like 1 o'clock in the afternoon, and
Yep.
I fasted all night and all morning. And because
Mhm.
what am I gonna eat at 3 a.m.? I'm gonna,
Right. Yep.
whatever. And it
Yeah.
was a little elevated. That's fast. Oh,
Yeah.
that's funny. I just
Yeah.
thought about that. I'm
So
scrolling right now.
something
Sorry.
I know. I know. So this we had two articles that Terri and I had sent back and forth between each other. This was one of them. And it talked so basically it talked a lot about that they are finding that there needed to be more research between these links, right? Between
Mhm.
SSRIs and then these metabolic syndromes that are occurring for people along the way. So my question would be, is it occurring after the start? These guys had 16 weeks of this med in their body. Okay.
Mhm.
What happens after 25 years? And what
Yeah.
happens more so when you start to change the levels and you start to continuously bring that level down?
This makes me curious because
That's what I want to
do you remember the, episode we did on alcohol? And when you are bringing the level down, you're more likely to have, some reaction with alcohol to make you be more, impaired,
Yes, more impaired.
more drunk,
Yes.
more
Yep.
drunk. Yeah,
Yep.
exactly.
Yep.
When you're bringing your levels down, so I'm
Yes.
like, this is really this is if anyone's listening and they are researching, this is the research right here. What happens when you are tapering your
Mhm.
medication? Like, does that
Yeah.
cause a cascade of metabolic problems?
And what
Um,
are they? Yep.
and what are they? And what should we
Yes.
we be watching for, and what should we not be dismissing, right? Then that doesn't mean that Jen needs to run out and start insulin and all these things. It's
Nope.
like
Nope.
to me, it's like this will go away because that was part of it. Part of that study was when they stopped,
Stopped.
guess
Yep.
what? It
It went
came
away.
back to baseline.
Yep.
It went
Everything
away.
moved itself back to baseline. So
Yeah.
that's one
Which
of
is
the
a
ones we
testament to
wanted.
your body, by the way, like a
I
testament to
know
like
because
the
it
healing
does
properties of
it
your
does.
body.
Yep. And it does what it needs to do. Now, don't get me wrong. I mean, there was like, I spent a week really pissed off and clearly just blasted this whole phone call
Yeah.
on my social media.
I'm more pissed
I
that
was
they put it as a diagnosis for you based on one lab test. Like,
Yeah. So
that
we're
to me is
gonna try to
fucked
get
up,
that.
but
We're trying to get that fucker retracted. But here's the deal, which it does cause issues, right? That's a pre-diabetes diagnosis, and so like if you're looking at
Mhm.
life insurance
Life
and health
insurance.
insurance,
Yeah.
for sure. Like that's the first thing I thought of because we may or may
Yeah.
not be looking at that right now, and that's a diagnosis that is going to
Mhm.
preclude you from either receiving it or how your rates are going to look.
Your
Um,
rates. Yeah,
one
for
fasting
sure.
glucose level. So,
Right. This second study though,
oh
this
yeah, you sent
information
me this,
came
and
from
I was
well,
panicking.
oh, wait, no. Is this the one that I sent you? From
You
Very Well Health?
Yeah,
Yeah,
yes,
okay. I must have
this
sent
is
this
a
one to her.
huge
Okay,
study.
got it.
You sent me
Yes,
this
this
right
is
away.
and
Yeah.
I wanna tell you, this is from 2020, so this is now newer,
Yep.
right?
Yep.
And it was published in Diabetes Care, journal, which is cool that
Yep.
even it's interesting to me when, 'cause the other one that I was talking about was published in, a cardiac journal. It's interesting to me when other areas publish research about medication for psychiatric problems, and
Mhm.
I
Yeah.
think that's cool, but it's also gets really dismissed, but, or just not checked in on, anyway, so the title is called "The Association Between the Use of Antidepressants and the Risk of Type 2 Diabetes, a large population-based cohort study," and this was done in Japan in 2020. This study had 90,000 participants, which is
Yes.
giant. I mean,
That's a
it's a
lot.
huge study. It's a lot of people to look at.
Mhm.
They found that antidepressants increase the risk of type 2 diabetes.
Yep.
That's it. This risk increased with longer term use of antidepressants and higher dosage. And so they found that also with the heart studies. The longer you use it, the higher the dose, the worse off it is for you,
Yes.
which makes sense,
Yeah.
right? I mean, it makes
Mhm.
a lot of sense. The study also found that glucose tolerance improved when the antidepressants were discontinued or reduced back to baseline, right? So
Mhm.
what is
Yep.
your baseline is the question. Like, we never know what people's baselines are because we keep adding in more shit, that doesn't allow them ever to get back to
Right.
baseline?
Right.
Yeah.
Right, and it's also and some of that also, right, this is where some of it can be arbitrary, right? Because if you're somebody who's taking an antidepressant like myself for, 24 years almost or whatever the hell it is, I don't even know. That's math. I don't do well with that. But where
Mhm.
your baseline is almost arbitrary at that point. I'm not going to go back and look at a baseline from when I was 17 years old. My body has changed so much since then. Like
It
I've
has not since you were
environment.
17.
I
What?
had those 2
You've
tiny
been
humans
pregnant?
who took
Yes.
every fucking lick of everything out of me, right? Like, so when you think about this, right, like
Mhm.
I will have and I actually at one point had my doctor talking with me a little bit about baseline stuff, and I kinda just chuckle because I think that part is arbitrary too. Now, if you could
Yeah.
say, we've tested this every single year for the last how many years, we could kinda get a baseline, but can we? Because I don't know what originally it should have been in the first place because this has
Right.
always been in my body. Always.
Right.
And what we
Right.
know as well is that it's always impacting the metabolic functioning in some sorts because the body is constantly interacting and trying to just reach these levels of homeostasis. Right
Right.
now, my body it's trying every day to get to homeostasis. So
You can
my blood
tell, like,
sugars might go
she
through the
knows,
roof.
right.
It's
Yeah.
changing every time I do a dose reduction and then all that time in between. It's
They just happened to
constantly.
hit you on a day that, your
Yeah.
body was reacting metabolically to this.
And
I do wanna
yeah.
bring something in
Yeah.
here real quick too, because it does say, there some studies have found that SSRIs help control blood sugar in the short term.
Yep.
Um, in the short term, that's important, to understand, and we can probably go back to that whole stress conversation that we had before, that in the early stages of use, people do often tend to feel better, right? Like in the very short term, early stages, and that's where then the studies are cut off and you're good to go.
Yep.
Um, but so in the short term, so if you're like, well, that hasn't happened to me, and they say that it helps control blood sugar, that's great, but that doesn't mean for somebody else that it's not the opposite. That both can be true at the same time, and it's really all person dependent.
It is.
Um, yeah,
It
it's
it
really all
is.
physiology dependent of the person,
It
right?
is.
And
Yes.
and I would argue that it probably has less to do with your lifestyle than it does with the medication.
Right.
Mhm.
Right. Yeah, because in
Yeah.
my brain, that's where I start as a patient, right? We start to panic a little bit. But at first, and I'm thinking, okay, my cholesterol is really high and my
Yeah.
LDL was super high, right? My blood glucose is through the roof. And the first thing in my mind, as like a holistic practitioner, I'm sitting here going, okay, what have I done in the world of nutrition lately that's different? Like say in the last
Yeah.
like 3 to 6 months, what have I done? And I'm thinking about all of these different things. And when I pause long enough, I'm like, wait a minute. No, like none of that adds up because that
Right.
stuff is really dialed in and I take really good care of myself in that way. I had to when I started titrating off of Lexapro. I had to. It's like the only way for me because otherwise the titration would be horrific. So
Right.
you start going there at first as a patient, but then you get yourself to a space of like what I'm just going to say is reality and go, this doesn't add up.
Doesn't make
And
sense.
of course, they want to do more blood work and they want me to do an A1C and they want me to start looking like they called it pre-diabetes protocol, is what she had said to me, and start looking at that. And I'm just sitting here going, yeah, I'm not buying it.
Yeah.
Now, the reality, though, that some of us are faced with that we also can't dismiss is that I could have abnormalities within how, in a metabolic way, because of this medication, because
Mhm.
that is also a reality that you can develop diabetes, you can have issues with insulin resistance, with heart rate, blood pressure, pancreas and liver functioning, specifically
Mhm.
liver. That's another one. Don't go down that dark hole, guys, and start researching liver and SSRIs. Okay.
Well, they
With
just did a whole big thing
SSRIs.
on sudden cardiac death
Yep.
with
With
SSR
SSRIs.
with
So this is a
all the
reality.
antidepressants. But yeah, this is
That's
reality.
the
Like,
shitty part of it too. So I can't dismiss that either. And I have to pay
mhm.
attention to my
Yes.
blood sugars and I have to start monitoring this because it could
Yeah.
be a reality for me too.
Right. Yeah, it's just an interesting conversation and one that we want you to know, like, okay, so let's say you're on an SSRI or an SNRI for a long time, and suddenly your blood sugars go haywire, and you ask the nurse, just like Jen did, is there a relationship between this and that? And they go, oh no, it's
Oh,
just your pancreas, right? I want you to not take that as the final answer, right? Like, it's not the final answer.
nope.
And so then the question is, well, then why is my pancreas suddenly responding this way? Like, what is it? So I guess this whole thing is just like your health status is not stagnant, and you can be curious about whatever you want in your own health status as long as you want to be, right? If
Mhm.
you want to just go down the regular, a Western medicine route and start taking more pills for this and pills for, then you have the right to do that too, you
Right.
know. But we would prefer that you get curious about this,
Start
obviously,
digging. Start digging.
especially when I see younger people. And when I say younger, I'm like 40 and under, in their 40s and under. Like, this is not normal for you guys to be struggling in these
No,
ways with your health,
you shouldn't. You shouldn't
And
be.
I'm not saying that it should be normal for a 60-year-old either, but it's more typical, I
Mhm.
guess, would be the thing. But then I would argue that maybe it shouldn't be typical for that group either, but that they're so medicated. But anyway, so the younger people that are having these serious problems with their organs is alarming to me.
Yeah.
And the dismissal that we have, well, would you rather have your depression or, type 2 diabetes? Well, sorry, Karen, I'd rather have neither. Like, I'd
Same.
rather not do either. Why do we do this stupid trade-off? Would you rather have, now type 2 diabetes and have your anxiety under control, Jen? Oh,
Yeah.
wait, at that point it was your depression. Would you rather have depression under control or type 2 diabetes?
Yeah, it was definitely depression. I developed anxiety.
Exactly.
I never had that.
Right.
I do
That's
now.
why I said that. Yeah. I'm like, she never had that's not why she was on it, but now she's an anxiety patient, which is just another conversation too. You
Yeah,
start with one thing, you end up with something
yeah, I
else,
was I
right?
was a grieving depressive patient, and I developed anxiety along the way. Yeah.
Fucking
Uh-huh. It's
stupid.
pretty I
I'm
know,
I'm over it.
I'm so oh my god, I'm so fucking over it. But but this is the stuff to get curious about, guys. So,
Mhm.
so that is what we wanted to present to you today. And don't be
Mhm.
gaslit by this, right? Don't be gaslit by the idea that all of a sudden you've got some medical things that are going on in your life. Okay. Even if you already have some pre-existing things, and they're getting worse, and it's not making sense because overall your lifestyle, you
Mhm.
are dialing those things in, right? So if that's the case, continue to get curious about it. Challenge your providers in this. Pull up research and show them. Again, research isn't the thing, but it can be a thing that you use, right, as a tool.
Right.
But at the end of the day, you can do things on your own to monitor these things, right? I went and started testing my blood glucose, got my ass on Amazon, spent $40, got a glucose meter and a bunch of strips and multiple times a day and repeated at the
Yeah.
same times. I'm measuring it, writing it all down, right? I've got a bunch of collateral that's showing me that you're probably okay. I don't need to move forward with pre-diabetes protocol, but I do need to pay attention to it because the reality is some of these metabolic things can occur, and they can occur at the cost of taking long-term SSRIs. So,
Or possibly tapering.
or
So,
tapering.
yeah, yeah.
That's the call
That's
for
interesting
research.
one.
It's the
That's
research
the call for
call.
research, yeah.
We're our research nerds.
I know.
Like, let's go.
Where are they? I'd
Yeah,
like
where
to
are you
know.
guys? I mean, we've
Yeah.
got it. Terry's got it in her, but I don't. I'm
Yeah,
getting
I don't even know that I do. Like,
old for
not
research.
anymore. All right.
So,
Well, that's
all right.
another episode of the Gaslit Truth Podcast. Thanks for hanging out with us. And please leave us all the 5 stars, only 5 stars. And make sure you like, comment, share. And you can send us your Gaslit Truth at the Gaslit Truth Podcast at gmail.com.
Thanks, guys.